What are the health and wellness issues for Black Americans? Black Americans typically lag in terms of life expectancy and access to healthcare. Research has proven that they are also more prone to obesity, diabetes, heart disease, and cancer. Let's look into the major health issues of Black Americans. What is Black health and wellness? Black health and wellness is an area of research and practice focused on the needs and interests of the Black community. Black health is often misunderstood as a holistic approach to well-being that includes physical, mental, and spiritual aspects. The term Black refers to people of African descent in the United States or elsewhere. It may also include those with mixed heritage who identify as Black or African American. The term encompasses a wide range of ethnicities, cultures, religious beliefs, languages, and experiences connected by their shared experiences as people of African descent living in North America or elsewhere. What are the major health and wellness issues that Black Americans face? The health and wellness issues for Black Americans can be complex and challenging. Here are some of the major health issues facing the African American community today. Heart diseases. Heart disease is more prevalent among African American men and women than any other ethnic group in America. While this may seem like a surprise to many, it is largely due to diet and lifestyle factors that affect the heart. The most common cancers diagnosed among Black Americans include colorectal, breast, prostate, lung, and skin cancers. Stroke. African Americans are more likely to suffer a stroke than any other race in America. A stroke occurs when blood vessels block or rupture, depriving oxygen-rich blood of reaching brain tissue. This condition can lead to serious disability or death if not treated immediately by medical professionals who understand its symptoms and causes. The incidence of cancer among African Americans is about the same as for white Americans. However, African Americans are more likely to die from cancer than whites. The most common types of cancer among African Americans are breast cancer and prostate cancer. Asthma. Asthma is a chronic disease that inflames and narrows the airways in the lungs and is one of the leading causes of hospitalization among African American children. The risk factors for asthma include exposure to tobacco smoke, dust mites and cockroaches, indoor allergens, mold, and secondhand smoke. Living in areas with high levels of air pollution, allergies, and a family history of asthma. Influenza and pneumonia. Influenza and pneumonia are the two leading causes of death among African Americans. Influenza is the most common cause of death from infectious diseases in the United States, and it's also the seventh leading cause of death overall. Influenza can be prevented with annual vaccination as well as by avoiding people who are sick. Diabetes. Diabetes is a serious health problem for African Americans, especially if they're overweight or obese. Being overweight increases your risk for type 2 diabetes, which can lead to heart disease and stroke, kidney failure, and amputations, among other things. If you're overweight or obese, talk to your doctor about losing weight, using healthy eating and exercise plans that work best for you. HIV/AIDS. HIV/AIDS is a major health concern for the Black community. According to the Centers for Disease Control and Prevention, CDC, African Americans are disproportionately affected by HIV, with more than half of new infections occurring among Blacks. The virus is primarily spread through sex and sharing needles, but it can also be transmitted from mother to child during pregnancy, childbirth, or breastfeeding. The CDC recommends that all sexually active people get tested for HIV at least once in their lifetime. If you're pregnant, it's recommended that you get tested for HIV as early as possible during your first trimester or before you get pregnant, if you have been exposed to the virus at some point during your lifetime. Why we need Black spaces. Black spaces are a place where you can ultimately be yourself. They're a place where you can feel the beat of your own heart and have no judgment or fear. They allow us to reflect and grow as human beings and see ourselves in a way we cannot see ourselves anywhere else. Black spaces are necessary because they provide an outlet for our emotions, which is crucial for humans to maintain mental health. These spaces will also enable us to find community with others who understand our struggles, share their struggles with us, and offer support when needed. From diabetes to hypertension, heart disease, and stroke, A strong epidemic of poor health conditions directly affects the Black community. It is essential for everyone, especially the Black community, to embrace an active lifestyle with managing their weight and a more extensive focus on nutrition education. The more we work together to build a healthier society, the greater understanding we can help bring to these issues.